right, and we're live again with the Health Innovators to Watch podcast. We have another guest with us today, Gillian Henker. Once again, I am your host for today, Dr. Candace Carpenter. I'm Co-Chief Executive Officer as well as Chief Strategy Officer for the Boston Congress of Public Health. And we're bringing you another episode, as I said, Health Innovators to Watch. And today, Gillian, I can never do people justice, but I will attempt to do a brief summary of who you are, and then I'll let you introduce yourself as well. So as the CEO and the co-founder of Sisu Global Health, Gillian has invented Hemafuse as well as some other different medical devices that she's been able to launch in multiple countries around the world, and was also named Baltimore Technologist of the Year fairly recently as well. Gillian, welcome to the show. Tell us a little bit more about yourself, where you grew up, and your inspiration for a lot of the things that you're doing now.
Yes, thank you so much for having me, Dr. Carpenter. So yes, my name is Gillian Henker. I actually grew up in Pittsburgh, Pennsylvania. My mother, father, and sister are all nurses, nurse anesthetists and critical care nurses. So raised by a family of nurses. My background's in engineering, though, from Michigan. And that's really where I focused on global health in my later years, and then really spun out and wanted to work on medical devices in emerging markets. So that's where Hemafuse came in and developed it. And like I said, I saw all of it from a sketch in a notebook that I had in at that time, all the way now through concept development, 3D printing, regulatory testing, and now, like you said, implementation in 5 different countries around the world, anywhere from East and West Africa to those using it in Ukraine.
Mm-hmm. Wow, that is just phenomenal. And Gillian, just reading, the personal statement that you had sent to the BCPH. So Hemafuse, as I understand it, so it's an auto transfusion device. Can you explain to the audience who say they don't know a lot about blood transfusions what exactly that is?
Yes. So more people might be familiar where you donate your blood and then someone else gets that blood who might be having a cancer treatment or, anemia and need that blood transfusion if they're losing blood. This device, though, allows a patient to somewhat donate to themselves. So it's your own blood that we, collect, filter, and then give back to you immediately. So it's your blood that you're receiving back to yourself in surgery when you might be losing blood due to different procedures. So instead of donating blood for someone else to get it, you are receiving your own.
Mm-hmm, mm-hmm. Yeah. And I mean, I'm not an anesthesiologist, but I'm very curious, how this process works. Like, is there a limitation to the amount of blood that a person can then get back to themselves within Hemafuse? And are the risks and benefits any different than, say, getting blood from someone else?
So a lot of great benefits of getting your own blood is that your body recognizes it. So sometimes when you receive another person's blood, your body, has a little bit of suppression of the immune system. So that leaves, higher risks of infection, as well as if there's any testing that might have been missed. But receiving your own, your body recognizes it, and, it allows you to then not have to worry as much about those complications of testing and whatnot, so you can get it immediately right away. We do, from the American Association of Blood Banks, only recommend getting 3 units, which is about 1.5 liters at this time, based on those guidance and the recommendations of auto transfusion practice. And we're continuing to get feedback and looking at doing further studies, of course, with our partners in the field.
Yeah, so fascinating. And I'm going to keep probing a bit more questions, but like I said, because I find the technology very fascinating. And so you've been able to utilize this, as you said, in some emerging markets. Has it been adapted the same way in these places, or has it been slightly different, or how's that journey been for you?
Yeah, so in different hospitals, different doctors really see needs in different ways. So I would say the first group really to hop on board are probably our OBGYNs, with maternal mortality being still a major issue and seeing the need for blood most acutely in those situations with maternal health. So the OBGYNs using this for a procedure called ruptured ectopic pregnancy surgeries, where the patient might have internal bleeding, and this device can safely suction, filter, and give that patient back their own blood. So they've kind of been the early adopters, I would say, of the device, are OBGYNs in maternal health cases.
Yeah, very interesting, especially since you said there's like a limitation, to the number of units, right? So I wouldn't say, massive hemorrhage after a trauma, etc. But I'm even curious, like, say, in a military context, like out on the field, if that might be an application, or what are some other things that you think that Hemafuse can extend to?
Yes, we're actually right now looking at opportunities to partner with military folks. Like I said, there are places in the Ukraine where this is being used. I would say that forward surgical units or places where blood supply is limited really is where this can make a difference. And I will say, though, that even when you have greater blood loss, Hemafuse can get you those initial units very quickly. You can use it within 5 minutes to get a couple units of blood. So that's where you're always going to need greater supply. More blood is always better, but this is the blood you can get as quickly as possible without, we say you can grab it off the shelf and go and not have to wait for lab coordination or cross matching, or which is where everyone has a unique blood type. This is your own blood, so you don't have to type it. So this can at least get you blood immediately. Of course, then other blood resources can be used in conjunction with this.
Yeah, very fascinating. And if I can backtrack just a little bit, Gillian, so you said Hemafuse emerged from a little sketch in a notebook. Can you tell me where you were, what got you inspired, and where was this sketch?
Yes. So I was part of a program at the University of Michigan led by Professor Kathleen Sienko, where it was engineers partnered with some pre-med students and multidisciplinary teams that went and shadowed clinicians at Komfo Anokye Teaching Hospital in Kumasi, Ghana, which is in Western Africa, and sitting down with the staff there. I'll also shout out Dr. Adoy, who is the person we interviewed and was the head of the OBGYN department there. We did shadowing on different sections of the maternal health, department. So I was in gynae surgery, labor and delivery, family planning, as well as outpatient checkups to look and document different needs. And this one, they put me on the list to look at a auto transfusion process called the scoop and sieve. So where there is no other blood available, I've been asked my blood type in these situations as well. Mine didn't match. So that's where they go and they scoop the blood from the surgical site, filter it, and then transfuse that patient the best they can. So that was where coming through and making a function, we call it a functional decomposition, what are the steps that are needed for this device or this process to really do the auto transfusion set, and then created a device from there with a group of engineers in that program.
Very fascinating, Gillian. And so how did Sisu Global Health come to be, and what other medical technologies have you developed or are developing?
Yes. So myself and then two other folks came together. My engineering background, and then a business background with Carolyn Urena, and then Katie Kirsch with a public health partnerships background, came together as the three founders initially and created Sisu Global Health. So that's kind of where it started for us to really get this device, and then bringing in a couple other devices into the fold that we have in different stages of R&D and IP. One of which that we have patented is a modular centrifuge that we call Revolve, that can be mechanical and electrical based on the needs of the lab staff at the time and the electrical grid at the time.
Yeah, very interesting. So Sisu Global Health, where does the name Sisu come from?
Carolyn's from the Upper Peninsula of Michigan, where she's at
Mhm.
even now. So it's a term Sisu that she grew up with based on the immigrant population that settled there. It's actually a Finnish word that means perseverance through adversity. So we really see it as something that exemplifies not only the team and the company culture that we have, but also the individuals that we serve as customers, users, and patients, those who persevere.
Wow, very interesting. Yeah, because I don't know, if I saw that description of Sisu anywhere on the website. So very fascinating. And just for the audience, we don't assume that people necessarily know a lot of things. So you use different terms like R&D and IP. So for our audience that may not know what these are, can you explain what that means?
Yes. So R&D is research and development. So like anything with engineering, anything scientific, testing, anything exploratory in design. And then with IP, excuse that, intellectual property. So that's related to like patents and inventions.
And the question I do have, Gillian, is so you're an engineer by background, and so there's the I myself have, as a medical doctor and surgeon, I've participated in similar things that you have as well, like getting together with multidisciplinary teams. And so I'm curious from your perspective, how many people are very similar to you doing as the engineer, the head of the company, and then also blending technologies with global health initiatives.
Other companies or other people on my team?
In general, that you've seen. So as I'm thinking about the audience, there might be an assumption that the people who lead companies might tend to be physicians or the people with business backgrounds, but you are the actual engineer leading it. So that's what I meant.
Oh, yes. So I would say that, yes, as an engineer, I consider myself a problem solver. And I'll say that part of me definitely loves the device and the tinkering and the creation of physical, mechanical things. But the other side of me really wants to see how this is implemented and really pushed out into the world. So that creation and that realization of mine is that, yeah, again, taking that sketch in a notebook, seeing it all the way through to making it into a device, but really seeing it in people's hands. And I see making a company and building out our mission to forward that goal is really what I'm passionate about at this stage in my career. So that's kind of where I've taken the leadership role and building this company up with that background.
Yeah, absolutely. And for people who are similar to you, what advice would you give them who, they're thinking, they have their sketches or they have different ideas, but they don't quite know how to launch into creating a company or doing some of the things that you've done? What advice would you give them?
I would say definitely one of the big things I love about our founding team and even our current team is the diversity of thought and reaching out to those beyond yourself. So I'd say that finding mentors and people that have done it or are different that can challenge assumptions. That's a really big one for me, is having your assumptions challenged is really important, especially as an engineer who's making something. You constantly want to make sure that you're refining and not just staying settled where you're comfortable in your shop. It's all about getting out there and finding people that can help you leverage those skills and grow also as an individual to find partners and find potential company mates, and then lead you forward to then getting it in people's hands.
Absolutely. And if I may segue a little bit more as well, so just going to the global health piece, from your perspective and all your journeys around the world, what would you say are some of the top pressing global health issues that you've encountered beyond, say, issues with blood transfusion, or you did briefly mention the Revolve and it as a centrifuge, but anything else?
I would definitely say it's about just resources in general and how we look and assess resources and making sure that we don't apply maybe the lens that we're like, again, it kind of is going through testing assumptions. We might think that, oh, okay, this is how it's done over here, so this is how it must be done, in a different spot. There is going to probably be a different approach or a different way to think about how to look at especially resource management and resource allocation and how that occurs. So that's where I just say, looking at task shifting, task sharing, and how to address healthcare needs through the resources that are available and most applicable that might be different than what we see, say, in the US, Western Europe, or even throughout sub-Saharan Africa. So as someone who loves design thinking, it's always about how do we achieve a specific outcome, not necessarily doing the same specific model or methodology.
Right, absolutely. And it just occurred to me too, that your focus has seemed to be within very either clinical or surgical settings. But then you also said military as well. I'm just wondering if there's anything else that we hadn't covered that you wanted to give a plug into, technologies that you're working on or anything like that.
Not at the moment publicly, but
No
definitely
problem, no problem.
we're open to discussing. Again, we're focused on healthcare in particular, but we know that even for us, like, there is veterinary care where there's not, you don't normally think of blood banks for dogs or for pets or for large animals. So that's one even where we're open to suggesting and working in that field as well. So.
Yeah, very interesting. And I myself, I'm not sure about this, but is it possible that things that you've created, for developing countries, emerging markets, that these could be utilized in, say, countries like the US, the UK, that are in fact developed and just different situations?
Yes, so we're actually pursuing some paths to look at the US market potentially moving forward. We do see this as blood is precious everywhere.
Yes.
And a lot of people in the US are looking to donate. I think COVID really gave a general sense of, okay, the system is really dependent on people's participation. But if you're in a rural area or you're up in more remote settings where you have an emergency that requires blood, we know that those are still scarce. So this device could really still be implemented in different parts of the US, even closer than you think.
And it has to be operated by someone else. It's not a sort of device where it could ever be like, where someone else could use it, say, on themselves, like if you found yourself needing that.
I would hope that no one will use this on themselves. At the moment, we're keeping it to sterile fields. So mainly in surgical settings where the patient would be under some sort of general or local anesthesia. So that's where we're keeping it right now in the hands of surgical clinicians, either scrub nurses, surgeons, or first assistants. Yes.
And then also, I'm just thinking about, so I have been an active member of the American Red Cross, and I think about not only that they're, uh, getting whole blood, but then they also do plasma and other things as well. And I think of all the big companies that are out there. I think one is called BioLife, where they collect a lot of plasma. It's fairly lucrative as well. I'm curious about Hemafuse. Is there something similar with the need to just collect and transfuse plasma?
Not specifically plasma. We actually really love that it's whole blood that we're transfusing, because that, especially for emergency situations or for the patients that lose the amount of blood that we're collecting, again, a liter and a half is quite a bit of blood to lose and collect. So that's where we're keeping the whole blood now, but that's where in the future we could look at other ways to do components and more specialized procedures. And at the moment, there are auto transfusion devices out there. We're just quick, simple, and effective is our positioning as a device, right? Where it looks like a giant syringe and it's meant to be quick and simple, grab and go for when a surgeon needs it immediately.
Wow. And how quickly can one utilize the device, as you said, and like auto transfuse that, like, say, 3 units?
So I believe our record for assembly are some nurses in Kenya. So I think they've assembled it in like less than a minute for sure. And then, it only takes a couple minutes to pull and push. So probably, you can get at least 2 units, I'll say, in about 5 minutes, maybe, 3 and 10. And believe me, anesthesiologists, the folks that are retransfusing the patient and usually calling for blood, they really love seeing a couple units come out and put on the stand. So
Yes, absolutely. Very fascinating. And I'm just thinking about even surgical settings in the US, say even if you are in a large academic center, there are times when, it takes time, right, for the blood to get to the OR, et cetera. So I myself have never seen it utilized, but it could be a quick kind of temporizing measure. It's like
Exactly. To match donor blood that is given to your own blood type, to do like a cross and match can take 40 minutes, 30 minutes. So this allows them to start surgery and get a couple units so that they don't, so then they can immediately have that on hand. But of course, then, we've had it where clinicians will have the blood arrive, at the end of the case, and they'll be like, oh no, send that blood back. We have
wow.
the blood we need. Then the part that we love and that we're looking to research further is the effect that this device can have, again, on the more generalized hospital system and the blood ecosystems in a whole country, to say, if you're using Hemafuse to substitute a couple of units of blood for every applicable surgery, how will that then, come back on the whole blood shortage that might be experienced in a region in a hospital? So we're looking to get more data on that moving forward.
Yeah, no, that sounds like very fascinating research for sure. Yeah, I personally look forward to seeing some of that as well. So Gillian, what is your general philosophy, I guess, towards life that's helped you to achieve some of the things that you've achieved?
I would say, we have these core values of Sisu that as founders we put together, and we really want to exemplify them for our team. So number one, I would say, is tenacity, grit, gumption, which is what Sisu means, that perseverance, I would say, is one. And then, like I mentioned, number two is learning culture, seeking out mentors, being humble in the approach to learn and understand that being an entrepreneur is a huge growing process throughout every stage. I like to say there's a theme for every year of what I learn and how I grow in my knowledge and my skill set. Number three, I would say, is, respect. So really respecting everyone that we come across and understanding that expertise that that person may bring, that, again, don't assume that they don't have something that you can't learn. And number four is inclusivity. So all of us are about, bringing in those partnerships, those customers, and those users to get their voices as part of the product, as well as part of our processes on, say, training or manufacturing our device. So.
Oh, I love that. I love all those different components that you mentioned. And so then my mind is jumping all over again. So I'll switch again and say, what is a typical day like for you?
So I will say that since right now I'm on the East Coast of the United States, in the morning, usually because folks in Africa are up earlier, I would say it's checking in with folks in the team. So I'll say, like, our biz dev folks and our trainers that are in Africa or in the earlier time zones, and then really checking in with folks if there's anything that's needed on the team front. And then even right now, this afternoon, I'm doing grant work and also touching base with the team on what we need from a grant that we recently got from the state of Maryland on, say, teleworking. So that's where, kind of going through of, like, contacting the team that's overseas, touching base with the team that's here in the US, and then, doing what needs to be done to get my team the resources that they need, which is usually grant stuff or like grant work and contacting potential partners for us to collaborate with.
Absolutely. And what would you say, like, in this journey of developing Sisu, Hemafuse, and some of the other things like Revolve, what have been some of the most challenging things that you've encountered, and why? How have you, like, grown professionally and personally?
Yes, I think one of the big ones I'll say is expectations and project planning. Or as of course everyone knows, you want to, as an engineer, I want to plan it to the right detail and have everything work out perfectly. But ultimately, I think it was a quote that came up from a boxing Mike Tyson, where he's like, everyone has a plan until they get hit in the face.
Yes.
So, as an engineer, I want a perfectly meticulous plan that I love. And then realizing it as switching on the entrepreneur hat, that fighting fires is probably one of my biggest roles as well, that I have to wake up and see what needs to be, worked on that day. So it's really saying that rolling with the punches, but not letting that get you down. Again, it's all about the ups and downs of things, but that's where I'd say is like, yeah, coming from engineering and now growing to the fact that things are going to happen. It's just how the world works, and working through it and doing the best you can to really make progress and, work towards your goals that day.
Yeah, absolutely. That resonates strongly as as an entrepreneur, not in the same space as you, but yes, the putting out the fires, but then also potentially failing forward. And one of the things that we like to say in BCPH is we're always building the plane and flying it at the same time, and being very comfortable with that, and then the discomfort as well, of not having those well laid plans, because as you know, like they can immediately be disassembled, and then you were starting from square one. What have been some of the more surprising things along this journey for you?
I can tell you, again, from a family of like academics and
Mhm.
scientists and nurses, who again are all more so in research and practice.
Mhm.
I would have never thought that would have gone into entrepreneurship and business. My younger self is probably would scratch their head to be like, "You're doing what? What
Mhm.
is that really? Huh? No, what about just crunching numbers and building stuff all day?" And I'm like, no, it's not what I anticipated, but that's again going where I see a great potential impact and great growth that I think I can have as a leader. That's what's
Mhm.
kind of drawn me into, again, not to say the other side, but to kind of combine and merge more things into what I'm doing right now that I wouldn't have known in my younger self.
Yeah, wow, I love that, and I definitely, that also resonates with me as well, and I want to, for younger viewers in the audience, to be open to that, because I think our younger selves can say, "This is how life is supposed to be, a very defined way," and then you don't know what you don't know, or especially many of the interns or younger fellows that I work with, I will actually challenge them to try new things, and they'll say things like, "I'm not that kind of person." I'm like, "You don't know that. Try."
Exactly.
Mhm. Awesome, awesome. So if we turn a little bit towards social justice, Gillian, what are some of those issues that you may have seen in Kenya, Ukraine, or some other things, as well? Because we consider ourselves to be a global social justice organization as well. What are some of the things that and you don't have to necessarily have been part and parcel of trying to help them with Sisu, but things that have either surprised you, gotten under your skin, or you wish people would pay more attention to?
I think a lot of people point to and I won't do like the acronym, sustainable development goals, or
Yes,
also known
yes.
as the SDGs,
Mhm,
for kind of the equity goals that a lot of people kind of use as their North Star.
yeah.
So I would say, I think number 3 is the healthcare equity
Mhm,
one.
mhm,
So I would say focusing on healthcare is, to say, a fundamental right as human beings, and having access to that, and being able to make sure that, again, people are able to receive the care that they need in their own communities. And that's where even saying it's not always just emerging markets, but even here in the US, in rural areas, people having to travel an hour, 2 hours to receive care. That's where we want to build devices that allow people to have that care
mhm.
locally, as close to their own community as possible. And that's where it's all about getting it more localized.
Absolutely. One of the things you should, what you're saying is we're all to define social justice means different people, and you can define it very traditional demographic, different types of racial groups, ethnic groups.
Ooh,
Hello.
Hi, sorry, I was looking just to see if there's
No, yes, no problem. So we're still live again. So sorry,
okay.
I really not sure where I left, but I was saying how I really appreciate the way that social justice issues can be portrayed. The traditional, very, I think, US centric way of underappreciated, marginalized communities, racial, gender, ethnic, sexual orientation groups, but then also can be based on one's geography. And that's not just globally, but as you were saying, Jillian, if individuals are isolated, if they're in remote or rural areas, either by choice, or by other socioeconomic forces that may have put them there. So lots of different ways to define and be able to help lots of different types of communities. I wanted to conclude with any ideas that you had left, Jillian, as a health innovators to watch, things that you want to do on the horizon.
Yes. Well, again, thank you so much for including me as part of this great community moving forward. I'm really interested to engage more, especially like what I was saying a little bit earlier was research and getting more data and how we also as Sisu can be part of the conversation about the impact that is being made and looking to actually like publish or get more information out there from our clinicians that work with us and our trainers, like our master trainer, Dr. Asma, to really show and gain collaborators on that front. So super excited to move that forward and progress in that area as well.
Awesome. Well, thank you so much again, Jillian, for this awesome interview. Just very fascinated to see the development of Sisu as well as Hemafuse and all of the other things that you're working on. Thank you, audience, for tuning in again. If you want to learn more about Gillian Henker, go to bcph.org and you can learn about her there, as well as follow her on LinkedIn. And tune in again for another episode coming up in a few days. So thank you again, Jillian.
Thank you so much for having me, Dr. Carpenter.